Aww.
Children are expected to get stronger as they grow.
She was such a good swimmer. Look how well she could sit, too, back then.
But at 20 months old, the Van Fraassens were told their daughter Rebecca had spinal muscular atrophy, or SMA. The rare genetic condition would cause her muscles to weaken with age. Bit by bit, Rebecca lost the ability to swim, stand up, and even walk.
It's almost like we're at war and we're being bombed and we don't know when the next bomb's going to drop.
At 19, Rebecca's an artist, but she's losing arm strength. Eventually, SMA may damage the muscles she needs to swallow and breathe. Then 2 years ago, a drug was approved showing some benefits. The price tag, over $700,000 per patient in the first year, and over $350,000 every year afterward for life. It's covered for most patients under age 12, but not many others, including Rebecca.
The amount they're asking for these drugs is just astronomical, and you know, we're just caught in the middle of this situation.
Nearly half of the new drugs released in 2016 and 17 were drugs aimed at treating rare diseases. Many more are coming, with price tags approaching $1 million per year per patient.
This is just the tip of the iceberg, I believe.
Physicians say it's a real struggle.
You want to instill the families with hope that there is a treatment that's coming, that there's something that could help their children.
With the help of certain patient groups, more and more families are mounting appeals and protests, hoping to pressure governments into paying for drugs the system can't easily afford.
The pressure is also coming in directly from the pharmaceutical companies who are pressuring governments to cover these drugs at really quite expensive prices, and then also, in many cases, funding patient groups behind the scenes who are then exerting that same pressure on government.
The drug company says SMA patients and their families, advocacy groups like Cure SMA, are not advocates for Biogen, but for their human right to have access to the drug.
So they're going to try and make as much profit as they can. But part of that is that the drug costs very little to manufacture. So there is room to negotiate.
What could simplify those negotiations is a national drug agency, one bulk buyer of drugs for the country to lower prices. The budget indicates the government is moving in that direction, but health policy experts say it's baby steps, and some families have no time left to wait. Christine Burak, CBC News, Toronto.